welcome you to the Rooted Remedies podcast. And I wanted to start off by saying thank you and hallelujah. I'm so happy I found your book. I'm
Hallelujah.
so happy. You connected the dots in a way that I had been looking for. And this was 6 foot tiger, 3 foot cage, and amazing,
Right.
amazing, life changing,
Thank
perspective
you.
changing. Yes, yes. So I would like to know more how you came to the conclusion. I know it was over time, obviously working with patients, but just to give a simple example, a 4-year-old comes in, has eczema, has a blocked airway, has behavioral issues. So what do you see? What is your process now over the years? Yeah, what does Dr. Liao see when he sees a collection of symptoms in one child?
Right. Great start. Allow me to share a few slides with you here
Yes.
because I think, well, the way this subject is, it's better if your audience could see a few images.
Okay.
All right. So let's see. Can you see this all right?
Yes. Yes.
All right. So 4-year-old with eczema and what else?
Eczema, behavioral issues, either an
Yeah.
autism
Not,
or
not
ADHD.
surprising. Not surprising, right? So, what the reason why I wrote all these books, starting with this one that you heard of, it's just because mothers aren't being supported to make what I call proactive health. In other words, how do you keep your child healthy to begin with? I mean, why are we in this reactive mode to fix symptoms after they arrive, right? Why aren't mothers being coached on how to avoid eczema? Why aren't children developing in a straightforward, hassle-free manner? I mean, behavior is already challenging enough. You don't need autism or ADHD or any of the behavioral challenges to get in the way. All right.
Yeah.
So I have a very simple theory from the beginning, and it's even more amplified throughout time. So just a little bit of quick introduction. I've written a lot about this topic called epigenetics, and I've taken research epigenetics to clinical. In other words, these are problem solving solutions for head scratcher problems. Okay, I've published some articles on teeth grinding. I published articles on how to resolve perplexing and resistant symptoms, such as what you just asked about. And this is the nearest and the dearest to my heart. And I want to start here to answer your question. Okay.
Yeah.
So every one of us, when we're born, we're nothing but the mouth, right? So you spank the baby in the fanny, you go, ah, and it fills the lung, and now it starts breathing. Then you feed the baby, quiet it down. And what happens to the baby after it's fed? It falls asleep, right? And then when it wakes up, it cries, you feed it again, and it falls asleep again after it's fed. And you repeat the cycle, and this is how they grow. So when the mouth and the nose goes wrong, this is where life starts, right? We agree on that so far?
I think so, yeah.
Okay. All right. So this is where it starts, right? So when that part goes wrong, the rest of the body goes wrong. Because I say that the mouth is the humans what roots are to plants. We grow from here. As moms, you would know this intimately, right? I mean, the kid grows under your watch, between your arms and,
Yeah.
and your breast, right?
Yeah.
Okay. So this is my granddaughter, and during the pandemic, my son, who's a chef, told me, "Hey, you're going to be a grandpa." I said, "Wow!" And then he asked, "How do I raise the healthiest kid?" I said, "Okay, the challenge is on, right?" So here's an example of how to naturally, because I know you're into root remedies, right?
Yes,
So this implies that you want natural solutions that attacks the root cause, right?
correct.
So how does somebody end up like this? And how do we take them from here to here? This is what a natural root cause remedy is, right? There
Yes,
is actually a best face that is programmed into every human being's genes. Our creator, be it nature or God, whatever your belief system is, wants us to have a best face. A face is a structure, and a structure is designed for performance functions. And if your face functions well, you'll have health. When it doesn't, you'll have problems. Back to your eczema
yeah,
and to your behavior issues. Okay. I think kids behave in an abnormal way to reflect some kind of discomfort inside, to reflect something that's not working inside, to reflect some functions that have been impaired structurally. All right, so you can't walk if you have a golf ball in your shoes. Not normally, right? You end
right.
up walking funny. Well, if you have golf balls with tonsils or stuff in your nose, you will end up like this. All right. And how does that golf ball get into your tonsils and your nostrils? Right. It's all from here. Back to where we started. The mouse is to humans what roots are to plants, right? So something alien, something foreign, something the body does not like, something inflammatory got into them. So I do a fair amount of guidance for mothers because we want to make this part work. So we need to understand that there are two kinds of dentists, okay? Uh, one fixes troubled teeth. I used to do all of this. I don't anymore because I want to find a root remedy too. All right. So I created this thing called airway mouth doctors. It's a new breed of dentists who focus on airway. Okay. It's called airway mouth doctors, or AMDs for short. They're trained in the diagnosis of this thing that I call impaired mouth syndrome. We can get into that. Your starting example of this 4-year-old with eczema is a case of impaired mouth syndrome. All right, a syndrome is a collection of symptoms that's connected to a condition. In this case, the condition relates to some slides I'm going to show you shortly. And this slide here, okay? So an airway mouth doctor fixes an impaired mouth that will cause in adults all these issues. In children, grumpy, irritable, they will end up with crowded teeth. They'll end up with various perplexing problems that defies managing, never mind solutions, right? So how do we get it right from the get-go? And if you didn't get it right from the beginning, how do we come back to balance and health, right? So I actually have a slide here that says, let's make proactive health, right? So once you have eczema, you're in reactive disease care mode. You're putting out fire. Why aren't we going to the doctor? Why aren't the doctors guiding us to avoid fire in the first place?
Right.
Right? Why are we lighting up doctors' offices with all kinds of crying kids because of this symptom and that symptom? Right? It's a catastrophe healthcare system because it's forgotten what healthcare is.
Right.
healthcare is about caring for health, and antibiotics is putting out infections. Why aren't we stopping infections in the first place? Or inflammation in the case of eczema, right? Why are kids bouncing off the walls? Because they're struggling to stay alive.
Yeah.
All right. They know that if they stay still, they might not wake up again. So we need to figure out the root cause of things. And so proactive health means that we want to get it right the first time. And if it's not the right the first time, let's find out the root cause so that we can get back to a proper start. A proper start is that this part needs to work for your whole body now. How's that so far?
It's incredible. It's incredible. And
Okay.
that's why when I read the book, I was like, oh, yes,
Okay. Okay. So
yeah,
let me get back to this part here.
yes,
All the expectant moms, all the um, new mothers, uh, I recommend that they read this book. All right. This is 90 pages. It's a tiny booklet.
yes, I've got
Uh,
it.
yeah. And I would just, flip through that, look at the pictures, read the captions. You can flip through that in an hour. Okay. And basically what you need to do is start from the beginning. After, breastfeeding is not a problem. Breastfeeding is being well tested by Mother Nature. Mankind will survive with breastfeeding, right? The problem comes from weaning. Eczema starts when weaning goes wrong, unless there's something very wrong with the mother. We're talking about normal people ended up with a bunch of fairly typical symptoms: runny nose, chapped lips, you know, uh, teeth grinding, sleepiness. Sorry. I mean, all right. So Gil Rapley is a British National Health Service home visiting nurse. She was assigned to visit postpartum moms after their discharge from the hospital. A month later, 2 months later, 6 months later, she would check in and say, "Hey, how are you doing? How's the baby?" All that. And she found that the big problem is not with breastfeeding. The bigger problem is weaning. And so I would highly recommend all your mothers, followers read this book.
Okay.
How to introduce solid foods so that this will work for them. And I agree because one, what you feed them at this point totally sets up the gut for success or failure. All right. So if you feed them foods that the immature gut lining is not prepared to handle yet, like um, um, a whole bunch of processed foods. Like I'm way against the baby food industry's offerings. All right. Um, they actually says introducing solid foods. As soon as, let's look at this slide here. You can barely see that the lower front teeth are starting to poke through, and they'll have a lot of saliva there. At that point, it's a perfect time to give them something crunchy. All right. Here's asparagus stalk. Here's drumstick.
Yeah.
Okay. Here's pepper. Okay. Carrots. And mothers worry about, well, would they choke? If they can sit up, they won't choke. Nature's built a lot of these instincts into babies. So stop worrying and start trusting that your baby is endowed with a lot of survival instincts. right?
Yes.
Now, so we follow this. My son actually, when I mailed him this book, he said, "Well, I got that already." I said, "Okay, pass on to someone else." Okay. This has become a classic. I think they've celebrated 20 or 30 years of this now. Really remarkable. So we put my granddaughter on this, and this is what she looks like.
Gosh, it looks great.
When you exercise the jaws and you don't feed them these commercial offerings. I know this makes it a lot harder on a mother who has to do a full-time job and then look after the kids and, do the laundry and put dinner on the table, 20 meals a week, all of that. Okay. But this is what humans are designed to develop. Now, let's kind of pause for a moment and get past this thing about, oh, she looks beautiful. Well, how does a child grow? A child grows from the genes, not from the mother. Okay. There's the nurturing and there is what? Nurturing, right? Nurturing is gene expression. All right. I cannot turn her into Julia Roberts. Right. But I can bring out the best version of her from the genetic blueprint that she inherited from her mom and her dad. All right. So that child who ended up with eczema, well, the genes are not getting fully expressed because something interfered with that gene expression. It's like you step on a garden hose. Eh?
Yeah.
Now the plants on the other end of the garden hose is not getting nearly the water it needs to thrive. So it wilts. And symptoms are bodily reactions that I'm not getting what I need, or I'm getting too much of what I don't need in the case of inflammation. Okay.
Yes.
So 90% of, because her father's a chef, 90% of all the meals she's consumed in her life is personally prepared by her dad at home. Because I raised him and he believed in the whole food theory. He
Yeah.
believed in the fresh home cooking. Okay. And that's why I recommend this book because we talk about why that's important. And if you buy convenience food, well, I'm sorry, there's a price to pay. And often eczema is one of them. All right. It's not the mother's fault because nobody educated them. Nobody educated the doctors on it. All we get are these push-up commercials and you know discounts at the supermarket aisles, and so we do what humans do, right?
Right.
But if you are disciplined to do this, you will raise beautiful children according to the genes that they're inherited. So this is called the epigenetic approach. Epi means on top of, like the top layer of skin is called epidermis.
Uh-huh.
So on top of genes, there are kind of like puppet strings that we can manipulate to get the genes to show, right? So what do we do in her case? That she shows up like this. Well, this means that according to her genes, right? We didn't give her preservatives. We
Right.
didn't give her fixatives. We didn't give her
Pesticide.
Roundup and
Yeah.
glyphosate sprayed stuff. We didn't give her box cereals. I'm sorry. I
Yeah.
mean, as standard American food as all of those things sound, they're bad. And that's why pediatricians are all writing prescriptions for antibiotics and whatever. Okay. But she has never had to have that. She did bump her mouth out once when she was learning to walk, and she broke a tooth. Now that tooth is gone. But you know what? You don't need that tooth in order to grow according to genes, right? So here's what I recommend mothers really pay attention to. Okay. You need to see the red flags early. You need to find doctors who not only are sympathetic, but they can offer proactive solutions. Okay. So you have to make sure that they swallow correctly. You can tell if they're not swallowing correctly if they do this, or their neck gooses,
Okay.
or their mouth grimaces, or they had trouble breastfeeding. They had trouble with latch. Those are all very early clues. And if your tongue does not work, the tongue is working before teeth shows up, right? So your tongue is the greatest determinant of how it works, how your mouth is going to grow. And so I feel that the tongue tie and tongue thrust is really important. And lip seal, like if you, I like this view where you're looking at the kid from the chin up. Okay. You can see if the nostrils are wide open. When there are slits, it means they never used it. So if you don't use it, you lose it, right? And it also means that their lips are apart because they're eating something that's congesting their nose. Now, I'll probably be hauled into jail if I tell you what all those things are.
No,
But
feel
you,
free.
you just look up typical food sensitivity items. Typical foods that causes something called food sensitivity. All right. So narrow, uneven nostrils tells you something. Uneven eyes, like one eye higher than the other, one ear higher than the other, it means the head is tilted. The head needs to be mounted correctly on the neck because otherwise the head and the body is got a garden hose that's twisted. And they're not going to communicate properly. All right. Um, Ear, nose, and throat infections. Kids who's got ear tubes. My God, why do they even need that in the first place, right?
Right. Right.
Uh, so it all goes back to the very beginning when the child is born. So the perinatal history is very important indication of how the child is going to fare, even before you get to weaning. So is the child full term? Um, was it vaginal delivery? Because if the mother is healthy, vaginal delivery actually imparts the mother's microbiome into the um, uh, respiratory and digestive tracts of the baby. All right. So now you have immunity imparted from that birth canal journey. So people say, well, geez, I had C-section. Well, all the more reason why C-section babies needs a whole lot more awareness from
Yeah.
mom about the extra TLC needed, like probiotics. Like, don't give them anything that is likely to cause immune reactions. They have less immune protection. Sorry. They're just shortchanged. C-section babies also faces a certain challenges because their skull bones are, so the skull bones breathes just like the rib cage breathes. In order to breathe, the joint between the bones that make up the skull. So think of the skull like an igloo made of blocks of ice. They're joined at the boundaries, and that joint actually breathes. So when you come through the birth canal, the skull bone gets squeezed, and then when it's popped through, it does this. Now you have primed a pump. It's called a craniosacral pump that makes a cerebrospinal fluid flow. When I see something like this, I know that the understructure of this skull is asymmetrical. That means that the craniosacral structure is off And very likely, in the absence of the birthing process, birth canal journey, that it didn't get primed. So now this kid is behind two AVALs. In this book, I also wrote about if you could have a optimal plan, like retirement planning, you
Okay.
should plan for birth planning. Then the mother's own cranial sacral structure should be checked out by someone who understands this. So that the maternal pelvic structure, which by the way reflects their head and
But
jaw structure,
I was amazed when I read that part.
right?
I was like,
So your hip bones
ah,
and your ear bones is called a temporal bone. They actually mirror each other. So if this is off, it tells me that the maternal pelvis may be off. So the baby is born according to the maternal pelvis. It's like the cookie cutter mold, right?
yeah, yeah.
Okay, so now what do you do? Well, thank God there are healthcare professionals who knows how to straighten this. Okay, one of them is a cranial osteopath. That's an osteopathic physician who knows how to tweak these skull bones. That's a very specialized, I highly price them for their capabilities. Craniosacral therapists, they're not doctors, but some of the more experienced ones, they can do amazing things. I had a baby. I mean, I didn't, it's not my baby. I had a friend who, as an acupuncturist, when she was going through acupuncture school, she called me and said, "Hey, I have a classmate. They have a newborn baby. And for the last 2 months, ever since he was born, would not stop crying through the night. Parents are exhausted. You got any idea?" I said, send them to a cranial osteopath. One visit, problem is over. One visit. It's how powerful this can be. Okay. So this part here tells us a lot about whether or not the skull bone has the kind of balance necessary for it to function. You have one leg long, one leg short. Sooner or later, you're going to have low back and neck problem. Okay. So you want this to be within functional limits. You don't have to be perfectly symmetrical like precise mirror images. But if you look at my nostril, they're both wide open, they're both round. All right. So that's what you want to see. Oh, I actually have that on my next slide. See this? All right. Why is this important? Because there's room for all the teeth to line up straight. Now, she's not perfect because these two teeth are not exactly even. So her mother's pelvis wasn't exactly even either. But it's even enough that there's not going to be a problem. All right. So from the corner of your eyes to the corner of your mouth is this purple bone called the maxilla or the upper jaw. This is your mid face. The nose is nothing but a tunnel through that mid face. Underneath this mid face, this part here, there's another pair of mini lungs called sinuses that also breathes and warms the air. Okay. I have some pictures of that. Yeah, right here. So here is the brain. Here are the eyeball socket. Here are the sinuses. Here's the nasal tunnel. So this is like a slice of this head through the middle here, and you open it up like an apple. Okay. So a healthy nostril has, so black is air, gray is tissue. There's some tissue, but it has a healthy amount of black for air to go. I promise this will be the only anatomical x-ray slide you're going to have.
I
It's
don't
really
know.
important to know this, okay? So if you look at a typical child, Uh, you hardly see any black hair because it's
Obstruction.
swollen. The soft tissue in here is swollen. Why? It's because there's an injury. There's something that's offending this thing. So when the kids are breathing with their lips apart, hmm, it's not because they want to breathe with their mouth open. It's because something is bothering this air entering the nose where it belongs. There's no corridor for oxygen delivery here. So that's why the kid has to breathe in the mouth. The moment you start breathing through the mouth, the nasal functions are not being delivered to the air entering your lungs. So the tonsils become inflamed, filtering bacteria and viruses, temperature differences, um, pollens, uh, air pollutants. All right. So when you have this and you start mouth breathing, I want to show you this very famous rhesus monkey experiment that they did in Sweden way back in the 1980s. They plugged the nostrils of these monkeys with silicone plugs. So the kid has to breathe with the mouth open. And look at this,
Yeah.
glazed eyes. The midface does not grow. The lips go short. The mouth is apart. There's no tone here. And guess what? Inside the mouth, the teeth go wild. They don't have this. Okay. This is nice and round arched because the lips here act as a giant rubber band, naturally directing and shaping these teeth. So you want a pretty smile, you got to start with being able to breathe through your mouth. Now, when you eat healthy, you won't have stuffy nose. If you don't, you're going to have stuffy nose. You're going to have dental and orthodontic problems. Okay. If you don't eat healthy, you're going to end up with that. So I'm going to show you what that looks like in a second. But here is what we do. So this kid was brought to me by a mom who was already my patient. She recognized that, well, my daughter might be having a 6-foot tiger, 3-foot cage issue in the making. So we took her from here to here and from here to here. No braces, no drugs, no shots, just the way I described it. Proactive health. How to grow the kid in a way that is intended by God or Mother Nature. Okay. So how we do it is combine this when needed with the basic fundamentals I told you about here. Okay. And so all this work, if needed, is done outside the mouth. So that's why there's no shots, no pain, no threat. I mean, when we go to the dentist, what do we think?
Yeah. Drill, fill, and bill.
Yeah. Oh my God, they're gonna get into my mouth with something sharp and painful, right? No more. I mean, we do this absolutely without any uh, uh, of the typical dental stuff. That's why we call it a different breed of dentist. Okay. So now, this growth, if you want this jaw to grow to the point where there's room for every tooth to line up straight, that's what full gene expression is. How do we know this upper jaw is grown to the full gene expression stage, right? By the way, the cheekbones here is part of the upper jaw, the purple bone. So when the upper jaw is fully grown, you will have naturally high cheekbones. Okay? And a fully grown upper jaw will have room for all the upper teeth to line up straight, natural. Okay. So now, in order to grow that fully, you need to give them something to grow. So this is green smoothies, and this is bone broth, right? And this is describing that little book, Your Child's Best Face, that I showed you earlier. And it's just really simple. You just need a high-speed blender. You blend up whatever you want. You can have, my favorite is arugula or kale. I don't have the same thing 365 days a year. The body likes variety and balance. But you throw in celery, carrots, half an apple, half a banana for taste, tomato. It's like making your own V8 juice at home. Make it tasty enough that, chug it down and say, ah. You combine the best of the plant kingdom in this green smoothie with bone broth, the best from the animal kingdom. Now your body not only has what it needs to grow the jaws, like here, but it will also shrink the swollen turbinates. And I know some medical doctors have said that it will heal the leaky gut, which is the origin of your eczema. The inflammatory reactions all start from leaky gut. And leaky gut come from eating the wrong stuff. And so you fix that by giving the right stuff that will heal the leaky gut. So it's like, so leaky gut is sort of like when you go take a shower, your skin would melt because the lining does not resist water.
Right.
Right? Now you eat food, and that food acts as a sandpaper and it scrapes the inner lining and causes inflammation. Now the food leaks through the gut lining and goes into the blood, and the blood says, oh, wait a minute, this is not on my green list. So I'm going to label you as a terror. And so you're on my list that I'm going to inflame against. So from the very beginning, if we get this right, okay, if we get this right, then you'll end up with this, and you'll have very little to do with the pediatricians or the orthodontist office. If not, then you're going to be in a disease care mode. All right. So the secret is making sure that this part works, this part works, this part works. So now the path, the road forks in the forest, right?
Yes, yes.
The path less traveled is to nurture best face and top health from full of gene expression. The wrong path to take is just the same old, same old. The kid screams, you call the pediatrician, you call the dentist, and now they cry more.
Yeah,
So
especially after reading the book, I imagine the same thing happens to you. How do you not see every little kid and say, impaired mouth, come here. Hey, you have impaired
yeah,
mouth.
it's because we swim in a cultural tide of big pharma, big food, big oil.
Yeah.
I'm sorry, but it's um, um, the forces, the market forces we're up against as consumers.
Yeah.
Yeah.
So originally, this is all for my daughter that I poured into all of this, and I've been taking her to a cranial osteopath. Um, there's nothing chronic right now, but I do want to be preventative and be proactive about it all. And in reading the book, I was like, oh, this is me. I have to address
See?
my
Yeah,
problems.
yeah,
I
yeah,
find that amazing.
yeah.
Yeah,
It is everybody's problem because if you okay, so I see patients from all over the world. And the longer the family has been in America, I'm sorry to say, the sicker the youngest generation is in terms of the impaired mouth and facial structure there, in terms of the degree of crowding, in terms of the degree of lack of full development of the maxilla. I've seen the same family, 3 generations coming for checkup and cleanings. The grandpa who is first generation from overseas always has got the best airway. The one who immigrated here as first generation is still fares better than the one who was born and raised here and unknowingly, adopting the standard American diet. Pizzas, drive-throughs, Pop-Tarts.
Yeah.
Sorry.
No, don't be sorry. It's the
Yeah,
truth.
yeah. So the next slide just exactly speaks to this. Okay. There are
Yeah.
people who are watching out for this. Okay. This is antibiotics and beef sourcing. And you can go into glyphosate, Roundup, in oat cereals. It's in everyone. All right. So your only chance is what? Avoid cold cereals. Right. So it's just like a one slice summary. You have to have 4 original sins absent. I call them tongue ties, nasal obstruction, which we went over already, maternal hypothyroidism. This is the origin of the tongue tie. And gut inflammation means that you eat the standard American offense. Toxic chemicals and pollutants. We talk about glyphosate, and there's like, I'm sorry, but I think I have a slide here about, yeah, there's pharmaceuticals in your tap water and the restaurant's tap water, okay? Everybody's birth control pill and Prozac and whatever you want to
All of
think
it.
of it. Yeah, okay. They're measuring mercury levels here. They can tell how many fillings that's got mercury in it is in the household. Okay, so there's antibiotics in chicken. So when I go out to eat, I do not eat chicken unless I know where the source is. That means you need to go to a higher end restaurant.
Right.
Okay. I mean, you have to be very selective about what you do. I did an experiment. I went to my organic bakery. I got a brioche bun. I cut it open, left it out for 1 week, along with this tomato. This one was attacked by the mold floating in the air. This one was never touched. Why do you think that is? That's because there's glyphosate. The bugs knows that there's something toxic there that if I touch it, I'm gonna die. So I'm gonna eat this one that's organic. Doesn't have it. You can run the same test yourself at home. See if it grows mold. I mean, somebody was moving and the reporter was interviewing this household because she was writing a book on autoimmune disease. Why is it that inflammatory disease is so rampant these days? And they found that when they were moving out, that the Twinkies that the kids left under their beds from 5 years ago still look the same. I mean, there's no mold on it. They know it's 5 years because there's wrapping with expiration date. Right. So you eat that and you're basically killing your gut microbiome, which you need to thrive, which you need in order to have the kind of glow on your face. Right. So this is an example. She started like this. Her mother's a naturopath. And so her mother is also someone who trained with. So here she stopped braces. And mother was sitting in my class. And she said, oh, I got to do it your way. And look what happened. She went from here to the left to the right in 2 years.
Wow.
Okay. This is the kind of glow that I'm talking about. This is from healthy gut and healthy microbiome in your intestines. Okay. And you feed the good bacteria by eating good stuff. So it's a ecosystem for sure. And so sometimes you need to help the body along. If you look at her, her arch was not that bad to begin with. She has a small degree of crowding, but she has a choked airway here. The way to read this is that the more in the red, I mean, the more red and black there is, the narrower the oxygen pipeline here is. The more blue and white there is, the wider the pipeline. Okay. So anyway, we did our homework. We figured out what we needed to do. We gave her this appliance, and look what happened.
Beautiful.
This is 10 months. Okay. She started blossoming. She had her daughter's braces taken off and replaced it with this, plus the bone building dye. And so that's what this is in principle. There are all kinds of variations. This is a pair of turkey wings. You can put chicken carcass, your rotisserie chicken carcass, you can throw it in there. You can put oxtail, you can put spare ribs in there. You can put clams, shrimp,
Yeah.
whatever. One of my favorite dishes in an Italian restaurant is cioppino. It's fisherman stew in marinara sauce. Just give me that and some organic bread without um, um, glyphosate on there, and I'm a happy camper. Okay, because it's got all the ocean minerals in it, right? And so here's a pair of turkey wings on sale 5 years ago. It was like $3.02. I still remember that. Not that expensive.
Right.
Plug it in overnight. The next morning, it smells like Thanksgiving. Whole thing. Okay. So it's healthy food and you'll be satisfied. You won't be looking for junk food to snack on. And look how the jaw grew in reaction. No braces needed.
Wow.
The lips and the cheeks and the tongue, that is shaping this arch. And in the process, we gave her almost 100% gain in her narrowest cross-sectional area. That means her airway really grew.
Right.
Almost double, okay? And all her baseline symptoms got better. Her sleep disruption went from 8 to 1 in 20 weeks. 20 weeks is not quite half a year. It's
Right.
like 7 weeks is half a year, okay? So snoring, 8 to 2, headaches, 9 to 0, inability to focus, 10 to 4, vocal stress. She's training to be a soprano, 9 to 2, fatigue, 10 to 2. So it means that her total score, if you add up the leftover symptoms at the end of 20 weeks, is 11. She started out at 54. You subtract the 2, you end up with 43. Divide 43 to 54, you get 80%. Now, this cuts across medical, dental, mental, emotion. When you do this, there's no pain involved, no drug, no sweat. Well, you don't have to go to the gym to lose weight. There are no braces. And the kid just thrives so that the outcome looks like this.
Yeah. You can even see it in her eyes. Like,
Yeah,
yeah.
yeah. And this ability to just take one look and know if somebody is thriving or not, it actually is a reflection of your gut health. And guess what controls the gut health? But People who can't breathe, people who have stuffy nose, they don't get nearly the kind of oxygen they have. People who have choked airway, they're not getting the kind of oxygen they need for the good bacteria to thrive in their gut. So this is very much overlooked. And so I'm just saying that the mouth structure needs to be functioning, and the mouth behavior, usage, must be on the right track. And we as a culture has gone off the wrong track. And that's why this is necessary. I mean, look, this is a really important slide that I always give to parents. Okay. Uh, Here's sidewalk, here's evergreen, here's a cement wall. You know what this is? This is a pile of snow. 10 days after it fell in suburban Washington, D.C. suburb that is totally pristine. Look at how clean the sidewalk is. This is not like an industrial area. All of this is from air pollution. All right, things that you don't see and no longer smell in the air. But you know what? You give it a white background, it'll show up.
Uh-huh. Wow.
This is an over the counter uh, filter for tap water. And here's a clean filter. Here's what it looks like 6 months later. So when you go out to eat, they use straight tap water. This is what you're getting, including all the drive-throughs, including all the home deliveries, DoorDash, you name it. Okay. And this is the reason why there is this congestion monthly. And now you're in the wrong track. Okay, so I've said a whole bunch of stuff,
Yes.
but
I
you gotta
love
go back to
how,
control.
go ahead. What'd you say?
And you gotta go back to control this part.
No, clearly, I'm happy that I have in my children, I have a 3-year-old and a 10-month-old. I don't have anything directly to deal with immediately. Like there's no, but I am being proactive of it because as you said in the book, you have to look at it whether your child's mouth is an asset or a liability.
That's right.
And yeah, and then the quote, there was, I can't recall who it was from, but the awareness is being the first step to making the changes. Absolutely. And
Yeah.
so where I find that it's exciting because it's simple. The
Yes,
solutions to everything are fairly simple and straightforward.
Erica.
Yeah.
How did our ancestors get us here? Right? There was no, they didn't have dental floss.
No,
They
yeah.
didn't have pharmacy. They didn't have drugstores. There is a way.
Yeah, absolutely. Um, I just I'm more curious. I don't know. I feel like it takes a really specific type of mother to be curious and to want to get to the bottom of things as opposed to just accepting the diagnosis that she gets. Um,
Yep.
I have many friends with kids, and they just over the course of the years, diagnosis number one, diagnosis number two. Okay, I'm on prescription for this, I'm on prescription for that, and I'm like, don't now, especially after researching and reading your book, I'm like, don't you see that it's all connected? And I'm very frustrated because physicians don't see that it's connected because we've been so compartmentalized in our care. um, yeah, I now I'm like, we're up against a seven-headed beast that's like one's pharma, big ag, big oil, um, all of it. The blue light at night, I'm like, that's a new, I'm curious where you are now, because this book was 2017, right?
6 Foot Tiger, 3 Foot Cage is
Okay.
2017.
Yeah.
Your child's best face is actually 2022.
Okay.
Yeah.
Yeah, I'm curious what I know you've been successful. I can tell by the pictures with your grandchildren. And I'm just like, what do you do? Like, there's so much out there to scare you, to mislead you, to not even have you notice that they're all connected.
Well, you see, that's the reason why I wrote this many books because one, it's sorely needed, and two, we have lots of cases of breakthrough success. There are lessons in there, but it requires discipline on the part of the mother, particularly. Okay. This is called disciplined love. Okay. Uh, Discipline is not about punishment.
Right.
Discipline is about staying within the guardrails so that this kid could develop on the right track. And so, like, where's the mother's guardrail? All right. So if you're okay with drugs and prescriptions and surgery, by all means, that's what is called healthcare in America. I call mine proactive health. I want my granddaughter to grow the way God and nature intends for it to go. Right? So we're influenced by our environment, and the mouth is mediator between the external environment and the internal. So you got to be really on top of it, or else you are going to suffer the consequences of this.
Yeah.
They are organized. They have big pockets. They know how to get you because you're too busy and you have neither a time and sometimes not the inclination to go do the research. You just, I deal with my son who is a chef and he coaches a lot of customers. And he said, look, you can't wait until your hair is on fire to figure out what's for dinner. It's too late. You need someone who will plan it for you if you can't plan it yourself.
Right.
Yeah.
Right. For new mothers, oh, I had a question. I had a question. I obviously can't go back and correct how I ate during pregnancy, which I think I did really well. I'm into the Weston A. Price Foundation. I was a Boulder chapter lead. I didn't realize now until I've read your book and did more research into oral health that I need to address my own problems. But I was amazed at the mother's oral cavity affects the structure of the pelvis. As you mentioned before, a C-section baby, I was told I had to have a C-section, so I did. Um, and
But
because of that,
but you see, the need for C-section was never figured out why, right? So, why is there fetal distress that requires C-section, right? And
right,
because pelvic opening the baby's head is incompatible, right? Uh,
absolutely.
Dilation, the asymmetry, all factor that into play. And that's why I say if you want to be proactive, you will give yourself at least a year to straighten out the mother's mouth and spine and pelvic structures. I had a mother who had her third baby while in treatment with me, and she said this is the easiest of the bunch. I mean, throughout the pregnancy, not just the birthing process. Yeah,
Yes.
yeah.
Yes. I find with my son, who's 10 months, I eliminated grains completely. Even if they were soaked or sourdough or anything like that, I said, we're going to just eliminate that, see how I do. And that's another beautiful thing. Like the teeth will give you a response pretty immediately. Like I find that my mouth has responded quickly, like, oh, we like this. Here's the shine, here's the, viscous saliva all over everywhere. So that's part of why I have hope.
Yeah.
Yeah, this pregnancy, this last one, and postpartum has been incredible. And I do think it's the raw liver. I've been having raw liver, tons of bone broth, at least 3 times a week. Um, so yeah, I guess parting words of wisdom for if we could start all over, we would address it preconception, right? Address the mother's oral
Yeah.
cavity.
Yeah.
Um, in my case, curious that you mentioned. So I'm first generation Cuban, so I don't feel number one so disconnected in terms of the standard American diet. My grandparents were farmers. So I don't feel that my I'm much more resilient than my husband, for example, who is standard American diet and grew up that way and is now trying to turn the ship. But but even then I have stuff I know I have things to do. Yeah, so parting words of wisdom for mothers who need to address their oral health, even though they could not realize it. You've said so much. If you watch this, people will put two and two together. But
Yeah.
kind of the
Yeah.
elevator pitch of how to best take care of us and our children.
I would simply say that understand that the mouth is the humans what roots are to plants. And so if you have defective roots, you're gonna have defective fruits, right? So make sure this part works. And all the symptoms could be traced to this part not working. That's my parting word.
Okay, beautiful.
All right.
All right.
Well, it's
Thank
nice meeting
you.
you.
Yes, pleasure, pleasure.
Got it. I
I
hope
will,
all your kids and all your mothers well.
yes, thank you. Thank you.
Okay. That's why we do this.
Okay.
Thank you.
Yeah.
Bye now.
Bye.